Before you write a program, before you load the bar, before you blame someone's bad knees, do this. This one movement will tell you so much about how someone can move. It's a simple overhead squat screen, but what it exposes in the ankles, hips, spine and shoulders tells you so much. Quick disclaimer, this is not a medical assessment. It won't diagnose injuries. If you've got someone who's struggling with pain or an injury or a major issue, then send them to a medical professional. But as a starting point for PE teachers, coaches and athletes, it's the fastest way to see what might be holding someone back. In this video, I'll show you what to look for and how to fix it. So let's get into it. When we look from the front, this is what we want to see. Feet roughly hip width apart. Knees are going to track over the toes. We want a neutral spine and we want arms stacked over our shoulders. Now I'm performing this with a rod and with no shoes. I find this is the best way to show up faults that you could otherwise get away with. And here from the side view, we're looking for an upright torso, heels to stay in contact with the floor and the bar to be over the midfoot. You'll notice here that I'm struggling with my own mobility issues. So you can see that there's a little bit of forward lean and the hands and the bar come in front of the toes. We'll discuss that later. Now the first fault to look for, as demonstrated here, is the heels coming up off the ground. This can be a result of limited dorsiflexion at the ankle or calf stiffness. Now we can check this by doing a quick dorsiflexion test like demonstrated here. Have the person being tested keep their toes about 3 inches from the wall and ask them to move their knee as close to the wall as they can. You should then be able to tell whether there's a limitation here or not. Strategy number 1 for addressing this would be to release the calf muscles, the tightness in that muscle, by foam rolling it. Notice how I'm rolling my lower leg in order to try and hit all the muscles in the calf. To add a little bit more pressure, you can put one leg over the other as demonstrated here. And fix number 2 would be to use the test we did earlier as a mobility movement. Moving the knee as close as we can to the wall and holding it there for about 30 seconds. Fault number 2 that we're looking for would be excessive forward lean. This can be linked to poor ankle mobility, tight hip flexors and poor core control. The first fix to try for this would be a hip flexor stretch. 1 foot up, 1 knee in the ground, contract the core, contract the glutes, upper body nice and tall and a little bit of anterior pelvic tilt. Fix number 2 would be to use an anti-extension exercise like the plank, hips low, back flat, little bit of anterior pelvic tilt again and hold. Fault number 3 would be looking from the front here to find, and that's the knees caving inwards. And this might point to a weakness or an underactivity in the glute medius. One way we can address this is through explosive glute bridges. Feet flat on the floor, weight going through our heels, back also flat on the floor, tension through the core, and we want our hips to explode up through the movement. And next we can get the glute medius fired up using banded walks as demonstrated here. From the front again, we can be looking for the feet or the toes turning outwards. This is another reason why doing this with no shoes is good, because the grip can often hide this. This can indicate a tightness in the deep hip rotators. To address this, we want to foam roll the piriformis, helping release it. Another thing to look for from the side is excessive arch in the lower back. Now I have a little bit of trouble exaggerating this as my lower back tends to go the other way, but arch in the lower back might indicate some hip flexor tightness or poor control of the pelvis. To address this, we first want to release the hip flexor through foam rolling. And then we want to use the same hip flexor stretch that we did previously. And to try and improve pelvic control, we can perform anterior and posterior pelvic tilts. A good cue here is to imagine your hips are a bucket of water and you're pouring water out the front and then trying to pour it out the back. And another fault we want to look for from the side is the arms swaying forward. This can point towards poor thoracic spine mobility, tight lats, and pectoral tightness as well. To address this, we can first mobilise the thoracic spine through foam rolling like this. We can stretch the lats by putting our palms flat on the ground, moving our weight back till we sit on our heels and pushing our chest towards the ground. Feeling a good stretch as we reach overhead. We can then focus on one side by putting one hand over the other and getting a deeper stretch on one lat at a time. A great way to stretch out the pec is to use a resistance band and have our arm at roughly a 45-degree angle turning against the resistance. And if we move the band a little lower, we can perform banded dislocations with our arm up, horizontal to the ground, 45-degree angle at the elbow, and allowing our shoulder to externally rotate. Now, if you're unsure if someone's main issue is with their upper body or lower body, we can perform the hands-on head squat, which takes the upper body out of it. If their form automatically improves, then that points towards the limitations being mostly in the upper body. So the key to good movement isn't to just spam every mobility drill under the sun. It's about assessing where the issues lie and mobilising or strengthening the appropriate areas with the appropriate exercises. Down in the description, you'll find a downloadable cheat sheet, and if you've found this useful, don't forget to subscribe, where you'll find more useful coaching content. I'll see you next time.